Our next speaker is Dr. Kunnumakkara, and he is a professor at the Indian Institute of Technology, Guwahati. He had his PhD biochemistry from Amala Cancer Research Institute, and then joined Guwahati as an assistant professor in 2012 and as an associate professor in 2015. He has developed novel drug targets for oral cancer, and he developed different formulations of drugs for better drug delivery and bioavailability. And his area of research interest is role of inflammatory pathway in cancer development. So, Dr. Ajay, it's all yours.
So, a very good morning to all of you. First of all, I would like to congratulate the organizing team, especially Professor Aloksi Bharati and Professor Anju Srivastava for organizing this wonderful event. So, today I'll be talking about new natural solutions for treatment of oral diseases. And oral diseases are the diseases of the oral cavity. And 90 to 95% of the population experience one or more type of oral diseases in their lifetime. There are different types of oral diseases such as oral submucosal fibrosis, gingivitis, oral mucositis, oral erythroplakia, oral leukoplakia, oral candidiasis, oral lichen planus, periodontitis, dental caries, and oral cancer. So one of the most of these are inflammation-related diseases, and one of the most important or serious oral disease is oral submucosal fibrosis. So what is oral submucosal fibrosis? It is a chronic, insidious, and pre-malignant disease of the oral cavity, and it is characterized by the deposition of dense collagen in the connective tissue. And this condition actually was described by Susruta, and he coined the term as Vedari in ancient medicine, and this is a potentially malignant disease and was first reported in the people of Asian descent in the early 1950s. So in India, the prevalence rate is almost 0.5%. That means 50 to 70 lakhs of our population are affected with this disease. So, but the most dangerous part is that many people of oral submucosal fibrosis, they can develop into oral cancer. So in India, almost 7% of the oral submucosal fibrosis patients develop into oral cancer. And this is a multi-stage process. When you choose tobacco or arik nut, first some staining happens in the teeth or oral cavity, then slowly inflammation happens. Finally, then fibrosis happens, then you will not be able to open your mouth as usual, and then slowly it develops into oral cancer. So, therefore, suppression of, because OSMF leads to oral cancer, so if you suppress OSMF, you can, it prevents oral cancer. So what are the treatments available for this disease? Actually, there is no effective treatments till today available for this inflammatory condition, and the most common treatment is the use of steroids, but you know this use of steroids are not avoid of serious adverse side effects. So what are the risk factors of this disease? Actually, nut chewing and as well as tobacco chewing are the main risk factors of this disease. Nut contains a chemical called arecolin, and it can induce fibroblast proliferation, and then collagen synthesis finally leads to oral submucosal fibrosis. So how does this risk factors induces oral submucosal fibrosis? It is well established that through inflammation, these risk factors like arecolin or nut or tobacco induces OSM. So when you chew tobacco or betel quid, your epithelial cells get damaged, and then lot of production of cytokines, pro-inflammatory cytokines, IL-6, IL-8, TNF-alpha, etc. can happen, and this leads to oral submucosal fibrosis. So this is a paper published in 2015. They show the serum cytokines levels like TNF-alpha, IL-6 and IL-8 in oral submucosal fibrosis patients. And you can see that the levels of these pro-inflammatory cytokines are very, very high in oral submucosal fibrosis patients. And this is another study published. The level of TNF-alpha in oral submucosal fibrosis, you can see that in controls, it is around 6.93 picogram per ml. However, the patients with oral submucosal fibrosis is 23.46. It is fourfold higher than the normal level. So all of you know that TNF-alpha is the most potent activator of the transcription factor NF-kappa B, and NF-kappa B also related with inflammation and other chronic diseases. So there are a lot of studies published on the expression of NF-kappa B in oral submucosal fibrosis. This is one paper which shows that you can see on the left hand side, this is a normal mucosa, the NF-kappa B staining is very less. However, on the right hand side, you can see the tissues from oral submucosal fibrosis where the NF-kappa B level is very, very high. So that means safe, efficacious and affordable TNF-alpha and NF-kappa B inhibitors have high potential in the prevention and treatment of oral submucosal fibrosis. So which is the most potent inhibitor of TNF-alpha and NF-kappa B? Almost 25 years ago, it is published that curcumin is one of the most potent inhibitor of human necrosis factor alpha and NF-kappa B. This paper published in 1995, and now you can see if you search the word curcumin and TNF-alpha, you will get more than 1,000 publications from it. Same goes to NF-kappa B. That shows the effectiveness of curcumin in inhibiting TNF-alpha and NF-kappa B. So all of you know what is curcumin. It is isolated from the plant turmeric. These are the curcumin roots, and I'm sorry, there are some issues with the slides. Then the curcumin root, turmeric roots, and you can see the yellow color, and this is the yellow color that is present in the turmeric roots is the curcumin. And this is the chemical structure of curcumin, and it is not a single target agent, it's a multi-target agent. It can modulate different inflammatory cytokines, growth factors, transcription factors, apoptotic regulators, etc. And this is one of the paper we published in British Journal of Pharmacology in 2017. So what about the efficacy of curcumin for the prevention and treatment of oral submucosal fibrosis? There are so many studies, we and other labs published, preclinical studies published from other labs also shows the efficacy of curcumin in the prevention and treatment of oral submucosal fibrosis. There are so many studies, more than 100 studies, preclinical studies, and then some of them are listed here. For example, gingivitis, and these are the studies published, and you can see most of these studies shows that this compound inhibits inflammatory pathways and inflammatory cytokines. And there are so many studies published on oral candidiasis, oral erythroplakia, oral mucositis, and periodontitis, preclinical studies on curcumin, and almost all studies shows the effectiveness of this compound in the prevention and treatment of this disease. So what about oral cancer? Yes, there are so many in vitro and in vivo studies on curcumin for the prevention and treatment of oral cancer. some of them are listed here, and where many studies used curcumin alone, and many studies used curcumin plus other chemotherapeutic agents like cetuximab, gefitinib, then some of the natural agents like neem tea, then chemotherapeutic agent like paclitaxel. So many studies shows that curcumin in combination with these agents sensitize oral cancer cells to chemotherapeutic agents. So what is the mechanism of action of curcumin in oral diseases? So curcumin is known to modulate different pathways in oral cancer, oral diseases as well as in oral cancer. These include different apoptotic pathways, ARC signaling, JAK-STAT signaling, NF-kappa signaling, AKT signaling, VEGF signaling, TGF-beta signaling, Wnt signaling, etc. So far I have talked about the preclinical studies of curcumin. So sorry, I'm not going to in detail because there are a lot of studies published on the effect of curcumin for the prevention and treatment of oral diseases. So what about clinical trials? Yes, there are many clinical trials that shows that the effect of curcumin on the treatment of oral submucosal fibrosis. The first study published in 1997 by Hastak et al. They used turmeric oil and turmeric polyuracil, and the duration of the study was 3 months, and number of patients evaluated 30, and daily doses of turmeric 600 milligram they used, and what they found that oral dose of turmeric oil for 3 months decreased the number of micronucleated cells both in exfoliated oral mucosal cells and in circulating lymphocytes. This is another clinical study published. Not only turmeric they used tulsi also, that is another medicinal plant, commonly used medicinal plant. This study was conducted for 3 months, and 45 patients were enrolled in this study, and they have used 1 gram tulsi and 1 gram turmeric mixed in glycerin base. And the results showed that there is a statistically significant improvement in both burning sensation and mouth opening. And this study shows that this formulation shows an improvement of 70% in the treatment of oral submucosal fibrosis. The next study shows the efficacy of curcumin in the treatment of oral submucosal fibrosis. This was a randomized clinical trial. They have used 2 gram dosages of curcumin and for 3 months, and the age of participants were 18 to 50 years, and the test group shows increase in mouth opening compared to the control group. Not only that, there was a decrease in burning sensation on visual analog scale with a spicy and normal food. And this study shows that more than 85% of improvement in oral submucosal fibrosis symptoms. Then another study, recently shows that the efficacy of curcumin for oral submucosal fibrosis, and here 80 patients were enrolled in this study. The duration was 3 months, and this study shows that there was a significant clinical improvement in mouth opening and substitute symptoms like burning sensation, pain associated with the lesion, and tongue protrusion in the curcumin group as compared to the control group. And there are many other studies also showed the efficacy of curcumin. Again, this published in 2021 for the prevention treatment of oral submucosal fibrosis. Here they have used only 50 milligram of curcumin, and this study demonstrates the efficacy of curcumin and topical steroid to alleviate the clinical findings of OSMF. However, the most important part is that curcumin is comparatively more efficient than steroids for the treatment of oral submucosal fibrosis. And this another study recently published of the efficacy of curcumin on oral submucosal fibrosis. All of them are clinical studies. So not only for oral submucosal fibrosis, there are a lot of clinical studies published on the efficacy of curcumin for other oral diseases like aphthous stomatitis, gingivitis, oral erythroplakia, oral leukoplakia, oral leukocytis, etc. And almost 99% of the studies shows the effectiveness of this compound, for the prevention and treatment of this disease. Again, oral lichen planus, periodontitis, etc., etc., etc. So most of these oral diseases, curcumin shows very, very effective. And last year we put together all this, whatever we published and others published on oral disease, on the effect of curcumin on oral diseases, and we published this in ACS Pharmacology and Translation Science. The title of the article was "From Simple Mouth Cavities to Complex Oral Mucosal Disorders: Curcuminoids as a Promising Therapeutic Approach." So not only curcumin, we are working on so many other natural products in our laboratory at IIT Guwahati for the prevention and treatment of oral disease and oral cancer. These are some of the agents. Due to the paucity of time, I will not be able to explain everything, but a couple of recent work I will just show. So, there is a compound called butene. It is isolated from the plant toxicoid vernicillin. So we have shown recently that this compound, is a very good scavenger, and the antioxidant status is almost like curcumin only. And this compound inhibits the viability of oral cancer cells, and it inhibits the survival of oral cancer cells. Then it induces the apoptosis in oral cancer cells, and it inhibits the migration potential of oral cancer cells. Then it inhibits the invasive potential of oral cancer cells. And interestingly, we have also shown that this compound inhibits NF-kappa B and NF-kappa B regulated gene expression in oral cancer cells. So, in the first talk, Professor Kunnumakkara talked about mortality, role of mortality in all different diseases. So we have also analyzed the level of mortality in oral cancer tissues, and we found that mortality is highly overexpressed in oral cancer tissues. This B graph shows the expression of mortality in oral cancer tissues, and the C graph shows the expression of mortality mRNA in oral cancer tissues of northeast region of India. So both these studies show that mortality is highly overexpressed in oral cancer, and we have knocked down mortality. And when we knock down mortality, we found that it inhibits the proliferation and survival of oral cancer cells, and that also inhibits the inactivation of mortality, inhibits, suppress AKT-mTOR pathway, which is highly overexpressed in oral cancer. So later we have shown that Withania somnifera, Widafrin isolated from Withania somnifera, also inhibits mortality, as mentioned by Professor Kunnumakkara in the previous talk. So we have treated the oral cancer cells with Widafrin and found that Widafrin shows high efficacy in inhibiting or suppressing proliferation of oral cancer cells, as well as inducing apoptosis. Later we showed that Widafrin inhibits mortality in oral cancer cells and inhibits AKT-mTOR pathway. So, in conclusion, inflammation plays an important role in the development of oral disease and oral cancer, and TNF-alpha and NF-kappa and other inflammatory pathways are highly overexpressed in oral disease and oral cancer. So, natural TNF-alpha and NF-kappa blockers have high potential in the prevention and treatment of oral disease and oral cancer. So, clinical trials of curcumin, many clinical trials are already done, but other compounds, more preclinical and clinical trials are required. So this is my acknowledgement. I acknowledge the DIA Center as well as the DBT, DSP and ICMR for providing financial support. Thank you so much.
Thank you, Ajay. So the topic is open for quick 2 questions, if anyone. Yes.
Ajay, it is a nice presentation.
Thank you.
My question is about, did you check this modeling expression in clinical samples?
Yes. So we have used clinical samples from northeastern region. So hospitals in northeastern region, we collected the samples and then isolated the RNA, and we have, that's what I was showing the CE.
And that was, those samples were specific to the northeast region, not other parts of India?
No, northeast region.
Yes, Dr. Ajay, very quick question.
Yeah.
We see black turmeric also in the northeast region. Have you explored its potential?
Not yet. We will do it soon.
So with this, I'd like to thank Ajay for a nice presentation, and we move on to the next speaker.
Sunil, can I ask a question?
Oh, yes.
Questions.
One last question.
It's a very nice presentation. Very comprehensive and very viable approach to understand very critical level problem. So I have 2 questions, 4 short questions. In the beginning you talked about pro-inflammatory cytokines in blood. So did you check in saliva?
No, mainly these are in blood samples, plasma levels.
So then the second question is that not only look at the biology of the disease like this. There's the inflammatory stage. That is where you probably what is steroids will apply better, work better. But once it is moved to fibrotic stage, it's more like a irreversible type of thing. So, are you testing this in the curative intent or in therapeutic?
So both. So we want to explore both because first idea is that many people are using betel and as well as tobacco, and they can develop into oral cavity, oral submucosal fibrosis. So before reaching to that stage, we are to prevent. And the patients who are already oral submucosal fibrosis, we want to prevent and suppress that. Otherwise, many patients will develop oral cancer.
Regarding your query to salivary biomarkers, the same parameters which Dr. Ajay has studied, we have collaboration with that lab and we have studied same nutraceutical, same nasal product, and we have analyzed salivary levels of those biomarkers, so they go hand in hand.
The higher level, this is only 4 maximum 4 you get in the...
Yeah, exactly.
Any other questions? Yes. One quick question.
Sir, actually I'm an oral pathologist, so I would like to ask, there are different stages of OSML. So does this work on all the stages, or what is the progress of the cukal mill?
Actually, so there are many clinical studies, more than 12 clinical studies on the effect of curcumin on oral submucosal fibrosis, and most of the studies they have used in different types of patients. They have some mild dysplasia plus oral submucosal fibrosis, those stages.
Actually, this plastic feature is it's not necessary that in OSML we can see for this plastic feature.
I understand, but when I showed one slide, the inflammatory cytokines and everything is highly overexpressed in that stage also.
So that is actually common to all the oral diseases. The inflammation part is common.
Yes, that is why we are using anti-inflammatory agents. No, am I answering your question? Or
actually, I wanted to know, with the advancement of the staging, the bands are seen. In the initial stages, it's just the burning sensation, or you can see the whitish areas in the mouth.
yes.
So, have you seen any, in the clinical, have you correlated with the clinical cases also? The effect, it's of the, you have worked on the technological part, on the RNA part, but have you correlated with the clinical part?
Maybe we can talk, yeah, that will